Hi, I'm Carol.
And I'm Mary.
Let's talk about pets. So today on our show, we're going to discuss when to take your pet to the vet.
As a veterinary technician, we constantly get calls asking whether or not owners need to bring their pets into the vet for many different reasons.
And this is just going to be an overview of symptoms that can be associated with serious and chronic medical conditions. We're not going to go into any massive details, as that would be a very long episode.
We will most likely have many videos on many of the different symptoms that are related to the different diseases and disorders in the future.
So first off, we have vomiting. People think in cats that this is normal, when in reality it's not normal, and any more than like once a month as a hairball is not going to be a normal thing. Dogs don't really vomit as much either. And of course, there can be many reasons for the vomiting. And since we can't diagnose your pet over the phone, bring them in to see us. Also, if your pet is vomiting like more than 3 times per day, get them to see us as soon as possible.
The other thing can be lack of appetite or decreased appetite. Sometimes this can go hand in hand with vomiting. Your animal may not be vomiting, but they might not be eating because their stomach's upset.
Mm-hmm.
So if you've noticed a decrease, if you free feed and you haven't had to put as much food in recently, that's a reason.
Another reason is diarrhea. Now, this kind of goes without saying that this isn't normal, but for some owners, it happens enough that it seems normal.
Kind of going along with the vomiting and the diarrhea is dehydration. Both vomiting and diarrhea can cause your pet to become dehydrated. One way that you can kind of check your pet at home is if you kind of pinch the scruff there where that extra fur is and it doesn't immediately bounce back to its normal position, they're a little dehydrated.
Mm-hmm.
And that's another good reason to go see your vet.
Bleeding. If you see any kind of blood on your pet anywhere, see your vet ASAP.
Another thing will be like scratching or chewing. This can be signs of allergies, skin infections, external parasites, and then the chewing and scratching can be a little bit subjective, but it's more of a, if you're noticing it more, if you're noticing they're doing all the time, if they're waking up in the middle of the night doing it and waking you up in the middle of the night doing it.
And along with the scratching and chewing can be things like sores, pyoderma, hot spots, hair loss. The first sign of these might not be obvious in a pet that has really long hair or a thick coat, but you might see wet spots on their coat where they've been licking. In shorter haired pets, hair loss along with wet sores could possibly be seen, and there also might be a very pungent odor.
Yeah. Again, going with all the scratching and the sores and things, if you notice that your puppy or your kitty starts shaking its head, flapping its ears, pawing at its ears, then licking its paws, because that's really gross. Or even if you've noticed that they're like little ear hematoma or like a swelling of their ear flap, or an odor, all of those can be signs of an ear infection.
Lumps, bumps, and swelling. So these can range from tumors to abscesses to even soft tissue injuries. And from there, also limping, toe touching, or an awkward gait. So these can also be something as simple as a sprain or something even more serious as a torn ACL or a broken limb.
Now when it comes to our pets and going to the bathroom, if you have a cat and they have increased trips to the litter box, but they aren't noticing or creating large areas of urine, or dogs that are going outside and look to be straining, these can be signs of a blockage, meaning that they cannot urinate. That is an emergency.
So elimination accidents or asking to go out more in dogs or leaking urine when relaxed. Your dog that never ever goes in the house all of a sudden now has an accident. These things can be either urinary tract infections, crystals, or stones.
Oh, and cats can have that too. It's when they go and they start urinating around the house and outside of their litter box.
Right, exactly.
Sometimes going along with these urinary accidents can be increased thirst and obviously some increased urination. This can also be the beginning signs of many other diseases associated with age, including like diabetes.
Weight loss, even when they're eating really well, this can be a sign of so many things.
Lethargy. If you don't know what lethargy is, it's kind of like fatigue. Sometimes people say cats are lethargic, but they're not really. The difference is they just like to sleep a lot, but they'll still get up and be very active. A good example of lethargy is when your pet is unwilling to get up and come to breakfast or dinner or even its favorite treat, and they don't want to get up and do their normal daily routines.
Coughing. So in cats, this is never normal. In dogs, it can be chronic, but should also be explored by a veterinarian.
So what I'm going to tell you now is with several of these signs, the coughing, the limping, even actually, honestly, the vomiting, the diarrhea, if you have their phone available, if you take a video of them coughing or of them limping or take pictures of their vomit or their diarrhea, your veterinary technicians and your doctors are actually going to be very happy. We may be the only people that are like, oh yay, show me the video of vomit. But it helps us because your animal may not do whatever behavior that you're wanting to have checked out in that room. And this will give us a better idea of what's going on.
Absolutely. All right, thank you guys for watching today. If you liked our video, please click the like button below and please subscribe for future videos.
Bye.
Bye.